Hey everyone, Dr. Talley again here with Spero CBD. For those of you who haven't tuned in, this is our third session of these question and answer sessions that we're trying to provide people with accurate CBD information. For those that don't know for who I am, I recently have told people that I'm a Johns Hopkins trained board certified physician anesthesiologist with a master's degree in physiology and biophysics from Georgetown University. And I have some exposure to CBD during my training in residency at Hopkins with CBD for acute and chronic pain management. So today I want to wish everyone a happy St. Patty's Day, and I wanted to give a shout out to our registered dietitian at Spero CBD, Carlene. She actually posted a CBD smoothie recipe for you all on our Instagram page, so if you want to check that out. Also, we are running a St. Patty's Day special, 30% off CBD products starting Thursday, March 18th. Use promo code March 30, MARCH 30 for your discount code. So for our topic today, we're going to be talking about, can you get addicted to CBD? So jumping right in, quick answer is essentially no. CBD is non-intoxicating and cannot really get you high. It has a better safety profile than THC, which is the intoxicating psychoactive substance you'll find in marijuana. So a 2011 study was done on a small group of CBD users, and they saw that individuals were able to safely take up to 1,500 milligrams per day of CBD without any real major side effects. The high doses did not impair the psychological or motoring function of those that were taking the CBD. I see a lot of people tuning in now. I want to wave back to everybody. Thanks for joining us today. And then another study that was, they looked at addiction and heroin users. So there was a small study of 42 heroin users, and they were noted that if they consumed CBD, that they would have reduced addictive cravings. One other study as well, in chronic smokers, showed that those who were taking CBD and in terms of vaping it had a 40% reduction in the amount of cigarettes they smoked. So as you can see, there are many benefits to CBD, and there's a large therapeutic window for safety and effectiveness, which basically means when we look at medications or supplements, you want something to be effective at a low dose and have side effects at a much higher dose. So that range difference there is your therapeutic window. The larger the window, the larger a dose you can take before you'll start to see side effects. And from what we've seen so far, CBD does not seem to be addictive and has a very good safety profile. So this brings us to the next question. Is CBD habit forming? So again, the answer is no. Unless your CBD product contains above the legal limit of the 0.3% of THC, you won't have any real symptoms of habit formation from taking a CBD product. And actually, the opposite's true for CBD. The longer you take CBD and the more it builds up, the more benefits you will start to see from taking the CBD, as there is a build-on effect from it accumulating within the body. So it's best to take your CBD daily for about 1 to 2 weeks at a time to allow yourself to evaluate for benefits at that dose, as well as any side effects you might be experiencing. So our next question is, does CBD have withdrawal symptoms? And once again, not surprisingly, and a positive answer is there's no real evidence at this time to suggest that CBD has any withdrawal symptoms. If you suddenly were to stop taking the compound after several weeks of use, you should be rest assured that you won't experience any negative consequences. Now, as we kind of touched on earlier, if your product does contain THC, particularly a hybrid product that might have higher amounts of it, you might have slight withdrawal symptoms from the THC. Now, while marijuana isn't considered as addictive as harder medications or illicit drugs such as heroin and cocaine and methamphetamines, there is a withdrawal from THC. Again, not as bad as alcohol withdrawal and things like that, but people may notice that after they are no longer intoxicated from ingesting marijuana or smoking marijuana, that their anxiety can actually worsen. So while you're intoxicated, you might feel relaxed, but after the THC has left the body, you might actually have some heightened anxiety. So for those that are interested in CBD, if you are taking it, and you're concerned about a withdrawal, you can always taper yourself off with the aid of your physician or healthcare provider if you are really that concerned. But like I said, most people do quite well when they just stop CBD altogether. The next thing is CBD safe to take long term? Based on all the data we have thus far and the guidance from the World Health Organization, it's believed that CBD has a good safety profile and that CBD is not a supplement that should be considered at risk for abuse. So you should always request from the CBD company that you are trying to order products from that you see third-party testing results. Not only do they claim that they have third-party results, but you should actually be able to have access to those results to verify that you're not being exposed to higher than legal levels of THC, heavy metals, pesticides, infectious microbials, or extraction solvents that are used during the extraction process from the hemp plant. So these test results will reassure you as the consumer, as well as reflect the transparency of the CBD company that you are purchasing from. Now, we have another question here. Does CBD cause memory problems? So again, another reassuring answer here. There's no evidence at this time to suggest that CBD does cause memory problems. Again, if you do have a product that has higher levels of THC, however, you may have issues from the THC causing short-term memory issues while intoxicated. However, even with habitual marijuana use or high levels of THC, usually those short-term memory deficits will go away after you have discontinued taking THC. However, it does not seem to be the case for CBD. It's non-intoxicating, and it actually offers a sense of calm and therapeutic relief to boost your overall well-being. And actually, according to a study from University College London, CBD may actually improve the memory by increasing cerebral blood flow or blood flow to the brain, to the hippocampus. But the exact mechanism is not known at this time for how it works, but that's the working theory, that this increased blood flow may actually help with memory formation and retention while taking CBD. So CBD does seem to offer clarity of thought, particularly those who might have mild brain fog. All right, so now this one is kind of a little bit more serious area for CBD and one that's still being investigated, but what drugs or medications should not be taken with CBD? So again, this is why we always say to check with your physician or healthcare provider regarding this, because everybody's going to be different with the medications that they take. But from according to Harvard Health, while the interactions from CBD and another substance are rare, taking CBD with substances that cause sleepiness, such as opioids, benzodiazepines, which are Xanax and Ativan, antipsychotics, antidepressants, antihistamines such as Benadryl, or alcohol may lead to increased sleepiness, fatigue, and possible accidental falls or accidents when driving. So you might also notice that when you're taking it with other supplements, there's increased sedation and tiredness when taking it alongside things like kava, melatonin, and St. John's wort. And when you're taking CBD in conjunction with a stimulant such as Adderall, you may notice that you have a decrease in appetite, while taking it with the diabetes medication metformin or certain heartburn drugs like Prilosec will put you at increased risk for diarrhea. Now, those are more moderate side effects. The ones that could have a serious side effect, and you always should check with your physician, are taking CBD with the blood-thinning medication warfarin. Now, warfarin works by obviously thinning your blood to prevent blood clots, but when you take it in conjunction with CBD, the warfarin can actually become super therapeutic or thin your blood a little too much. So you've got to be very cautious taking it with the warfarin blood thinner. In addition to that, the heart medication amiodarone, its effects might be increased with the use of CBD in conjunction with it, while also increasing your risk for liver injury. And one other medication that comes to mind that's pretty frequent for people to take is a thyroid medication, levothyroxine, and taking it in conjunction with CBD can actually increase the effects of that medication. You might get sweating, anxiety, heart palpitations, or racing heart, things like that. And the reason that CBD has an interaction with these medications is because CBD is broken down in the liver, and there's a whole slew of enzymes called the cytochrome P450s. And there is a ton of these enzymes, and there are different ones that are responsible for breaking down different medications. So CBD does interact with some of these enzymes, and for the most part, there's not too much of an overlap or significant interaction. However, the last few that I discussed can have implications for serious interactions, and that's why you should always check with your physician. So I want to thank you all for joining me today. Make sure to tune back in about 2 weeks. We'll come back live here, and I'm happy to answer any of your questions that you might have. I'll scroll back through. Again, I see a bunch of people waving, so I'll send another wave out. Thanks for joining us today. I'm not seeing any questions at this time, but feel free to reach out to us, and we'll try and answer your question if you don't feel comfortable writing it on here for me to answer. Again, thank you for joining us. I appreciate the support. And feel free to visit us at SperoCBD.com for more educational content, as well as premium CBD products. So thanks for tuning in, and stay healthy.